Hello, good evening, guys. Welcome to the live broadcasting of Erufu, the online community medical support network. I'm Shireen. By the look of the face is the first expression of us to people. In this era, with the new medical technology, the aesthetic and anti-aging treatments are the natural part of life to improve and maintain a healthy appearance and build our confidence in life. However, we are newbie in this, wonder what we can do to improve our face. So today, I'm glad that we're able to invite again the medical aesthetic doctor, Dr. Alicia, the healthcare partner of Erufu Care, to give us another sharing on the latest trend in facial aesthetic that build a charming face with a confident life. Welcome, Dr. Alicia.
Hello.
Hello.
Hi
Dr. Alicia.
everyone. Good evening.
Good evening, Dr. Alicia. Before Dr. Alicia starts, I would like to have a brief introduction of her. Dr. Alicia first graduated from the University of New South Wales, Australia with a bachelor degree in medical science. She acquired a medical degree from Manipal University, India. It was not long before Dr. Alicia pursued her passion for dermatology and aesthetic medicine. She was trained in the Institute of Dermatology in Bangkok, Thailand, and the American Academy of Aesthetic Medicine. Her signature expertise include thread lift, double eyelid suture for Asian eyes, skin health maintenance, breast accommodations, and various dermatological problems. No more further delay, I shall pass the session to Dr. Alicia.
Thank you. Thank you for the kind introduction. So I should share the screen?
Yes.
Okay. All right. Oops. Okay. So thank you for the good evening, everyone. So today I'm going to talk about the latest trend in facial aesthetics. So a charming face, a confident life. Okay. So my talk going to cover a few topics on the facial features on Asian versus the Caucasian, and key features of an attractive man's face, and how does aging change your face? Why is facial aesthetic gaining popularity? And how can facial aesthetic reverse aging? And some take-home message. Okay. So first, before I go into treatment details, I'll talk briefly on the features on Asian and Caucasian. Okay. So on my left is actually Asian features, and on my right is actually the Caucasian features. So let's see about Asian features first. So Asian features born to be like our bone structure born to be a flatter face, okay, a single eyelid, flatter nose bridge, meaty around the nose tip, and rounder and wider and rounder face shape. However, in Caucasian features, there's more contouring. There's 3D face, and there's double eyelid, and high nose bridge, sharp pointed nose tip, and high cheekbones, and pointed chin. So people from Asian tend to sort of like thought to be attractive so after the Caucasian features. So we actually want to look more like Caucasian so that we look more attractive. Okay. So key features, so now we'll talk about the key features in an attractive man face. So men's features tend to be more masculine. So how to look more masculine, right? They will have an angular facial structure like this, angular, and have a stronger jawline, more symmetry, straighter nose, and a normal lip volume. So now further we'll talk about how does aging change your face. So when we are young, right, the triangle of youth, we actually we actually aim the inverted V. Okay, as we age, right, we actually going to be the pyramid, like the triangle. Okay, so the triangle of youth actually, the structure is actually supported by the volume and support, and whereas the aging, you actually have volume loss. So can you imagine like a construction, you need to have a strong base. So our skin actually supported by the bone first, okay, and followed by the muscle, fat, and then skin. So all these are the structural, like a foundation for the support of the skin. So once the volume is lost, there's kind of like collapse. The skin will somehow sag. Okay, so come to the muscle in balancing. So once the let's say as we age, right, the bone will shrink, the muscle will have imbalance, will shrink as well, and the fat will lose. So all these are the contributing factors that can cause the inverted triangle towards the triangle features. Later I'll show you some of the pictures. Okay, so the muscle balance as we age, can cause muscle imbalance. Okay, and the elasticity and the structure, as I mentioned earlier. Okay, with the structure, it can cause laxity, and the loss of elasticity can eventually cause laxity. Okay, so you can see that triangle of youth. So the meaning of triangle of youth is like high cheekbones, full cheek, defined jawline. So there's a V-shaped face. So as we nowadays, you will see that, oh, we want to look younger, this and that, they want a V-shaped face. So actually, a lot of them doesn't know like why they want V-shaped face, doesn't know the underlying why we need this V-shaped face. As we age, right, you can see the triangle. Now we look at the characteristic of aging. So you can see that the drooping of the brow, okay, the drooping of the brow, start from on top the pyramid, drooping of the brow, and then the hollowness of the eyes, and then the sagginess of the cheek, and down turning of the mouth angle, and this is called nasolabial fold. Okay, so as we age, right, our face tend to look broader because there's no support over the cheek. It looks like more triangle downwards. So how do we reverse it, right? There's few things that we need to consider, how to gain back our youth gradually, because we age gradually and we need to gain back gradually. Okay. Okay. So why is this facial aesthetic gaining popularity in this field? Because more people are concerned about aging and realize that the importance of looking good. And usually physical appearance give a very important first impression, especially when we go for example, we go for a business deal and interview. So the first impression is very important, okay? And more clients are aware of aging skin signs like wrinkles, laugh lines, and sagginess, drooping of the like the jawline, there's jowls, okay? So no longer this beauty treatment just for women. It also applies in men's. Men's also doing this kind of facial aesthetics nowadays, so that you look more macho, and then it will be more attractive looking, and more attractive looking, so that you gain confidence. And also because nowadays the cost of doing this aesthetics is more affordable now, and most of the procedure are minimally invasive, and it is a clinic procedure and doesn't require any admission to the hospital. If done, and this if it done, result are long lasting and it will look natural. Okay, so now we will be talking about how can facial aesthetic reverse aging? So one of the, so we'll talk about wrinkle reduction. So usually wrinkle reduction will be injecting toxins such as like Botox, the famous brand Botox, and Dysport as well are the registered product that will, what does that do is you relaxes the overactive muscle so that we don't as time goes by, we overactive certain muscles so that it will create like frown line, forehead wrinkles. It's a bit too technical, I know, but I'll show you some before after. Okay, but this treatment, how soon can be seen the result? Usually like after injection, probably a week. Then it will last probably 4 to 6 months, depending on how is your lifestyle. But yeah. Okay. So wrinkle, this is the eye wrinkle reduction. You can see the profits here. So after injection, they're reducing of the wrinkles over the profit. And the frown line, can you see over this area, the frown line? So this all can be sorted by this injection instead of like operation, this and that. And the procedure just take about 5 to 10 minutes or even less than 5 minutes. Okay. Because if you do not inject on this muscle, right, this is, can you see when she do the expression, there's this wrinkle. So as time goes by, right, if these muscles are overactive, even though you are not frowning, you have a line over the forehead. So to prevent that, injection should be done earlier before you get a permanent line there. Okay. And come to the eyes region. We go, this aesthetic trait, we will explain through from the eyes from above until below, yeah. So we go to the eyes, I mean just now the wrinkle, now we go to double eyelid. Okay, so what a lot of people doesn't know what is double eyelid. Okay, a single eyelid means there's no lines at all, and double eyelid means they will create lines. Okay, let me show you some before after. So okay, let's see. Okay, so this is, we call it monolid. Okay, and then this is double eyelid. Okay. Okay, so yeah, this is mono eyelid and this is double eyelid. Can you see? So this is another example, like there's no line here, and this is another line. Okay. So these are done just minimally invasive and it's not operation. Yeah. So it's permanent and it's immediate natural after 1 to 2 weeks. Okay, and it's scarless. Okay, now come to the jawline slimming. So what is jawline slimming? It's like Asian, usually just as I mentioned earlier, we tend to have a big jaw, a square face, and a shorter chin, right, for Asian. However, this one can be fixed if our muscle here, we call it masseter muscle, the mastication muscle means our chewing muscle. Asian tends to have a bigger chewing muscles. So all this, we can do injections to relax the muscle so they become smaller. It relaxes first and eventually becomes smaller and become more V-shaped. Okay, how soon can be seen this result? In a month? It can slowly reduce. You're sure wondering how does it work, right? It's like, for example, you let's say we go to the gym. So every time we go to the gym, where we're trying to work out and gain muscle, right? So just for example, that like we stop the exercise. Let's say we stop, let's say every day we go gym, they will gain muscle. So we stop the exercise, let's say during MCO. So we didn't do the exercise at all. So it actually, the muscle tend to shrink, yeah, tend to shrink and eventually become smaller. So this act the same. We do the injection is to relax the muscle and eventually smaller. Okay. All right. So how does it last? Oh, this is a bit typo area. Actually lasts about 3 to 5 months. Okay. So you can see that, oh, sorry. So you can see that this area here, it can actually cause slimming of the jaw. Okay. Okay, now come to volume. As I mentioned earlier, the structure for aging, one of the factors are volume loss and also the structure. Okay, and of course it can enhance our features. Okay, these treatments can be seen immediately once I inject the. Usually inject fillers. There's few fillers brands in the market, which is famous. And after injection, the result can be seen immediately. Okay, and usually it will last 9 to 12 months or even 18 months, depending on how is your lifestyle is as well. Okay, and I mentioned lifestyle means that if let's say you have a very good lifestyle, good hydration, it will be last a bit longer. If let's say you are having like smoking or didn't have proper rest, like lack of sleep, the effect of this aesthetic treatment is actually will be shortened. The result will be shortened. Okay. Okay. For this sunken eyes, right, you can see that the results, the before, you can see there's sunken eye over. I mean the volume is lost. You can see, then the overall you looks a bit tired and look haggard. With the improve the volume, it actually make you look more awake, okay, and less old, look younger basically. And this tear trough rejuvenation, you can see the dark circle, and there's a line here, dark. Can you see here? Okay, all this one is injection of fillers. It actually improve after this is immediately, this photo is taken immediately. Okay, this injection. And also the, okay, these lips. However, lips is very important. Eyes, for my opinion, communication is very important. Like eyes is the way how we communicate, and lips also one of the communication tools that we use to talk. Okay, so reshaping of the lips actually helps to make a person look more harmony. Okay, for what I say that because if let's say we have a kind of like inverted inverted lips, it will make you make your look either sad or angry. So with the elevated of the angle of the mouth, this we call angle of the mouth, a bit elevated, you make you, when you don't do anything, what I mean is like you don't have any facial expression, it doesn't look fierce, you look more friendly. Okay. And this one, for a short chin, receded chin, we call this receded chin if this chin are not protruded. So with this protruded, right, it actually improves the jawline and eventually double chin will be reduced as well. You portray that less double chin. Okay. Okay. So this as well, you can see that the volume of the face, there's a sunken over the under eye and also the cheek over here. Yeah. After improvement of all these volume, it actually help with, you generally look younger, okay? Okay, so we have another called Korean baby face, which is a fat grafting, where we use, just now the previous one we injected like fillers, which is a hyaluronic acid, and this is a fat graft. Fat graft means that we actually take the injected the fat into the parts that you need to replace the volume. Okay, and how fast you can see the result probably take a month, and how long does it last? It usually 3 to 5 years. Okay, so this one is what we do, that fat grafting, where we replace the volume for the forehead and the under mid face. We call this mid face, where you can see the tear trough. This is called tear trough, and the loss of volume here. Okay, tear trough, and there's a loss of volume here. So all this we can replace with the volume so that it looks more refreshing and also rejuvenated with the volume around. Okay, and the chin, and with fat grafting, it actually fat itself has contained stem cells, and this stem cell can rejuvenate the skin and make the volume last a bit longer, and the survival of the fat will last a bit longer. Okay, now come to the nose thread. Okay, a lot of people wonder what is nose thread, right? Okay, so for Asians, we tend to have a shorter nose, flat nose, nose bridge, and short nose tip. So what we can do to make the face more projection, like more 3D. So we usually, the nose is one of the features can make your, basically all the features like the eyes, double eyelid can make your features look more 3D, the nose and the lips, and also the chin. So that our feature look more protruded, and we'll have a more contour facial. Okay, so for this nose thread, what we do is we actually put in the nose thread, and besides nose augmentation, we can actually inject fillers as well. Okay, so this result will be seen immediately, and it will last about 6 to 18 months. So this is the effect. Like some of them, their concern is the nose bridge is not high enough. Then we will inject, we will put in the thread so that you have more reshaped the nose and also higher nose bridge and also the tip. Now come to the dimple creation. So what is dimple? This is, can you see my dimple? This is the dimple. Okay, so some of them think that dimple creation, with dimples will smile sweeter. So and this can be done. Usually this is natural, means come with you, like naturally birth with dimples. But however, this can be done non-surgically. Okay, and this one immediately it can be seen. We do it like non-surgically, and but it will be natural for in a month. Okay, and it will last permanently, like this one here. So what we do is we will, patient usually will choose where they want to have the dimple, then we'll fix the dimple where the location that they want, the position. Okay. Okay, so HIFU, what does HIFU do? Okay, there's a, just now the aging, we talk about volume, we talk about laxity, we talk about volume, structure, volume, and laxity, and muscle imbalance. So muscle imbalance, we already mentioned we can do injection of the Botox so that it relaxes the overactive muscles, right? And volume we replace by fillers or fat. And HIFU, and now we talk about sagging of the face, of the skin, okay? HIFU, the full form is called High Intensity Focused Ultrasound. So this technology is a what is that called? Is a non-invasive, means we got no injections and no surgical to have facelift. Okay, so what happened is this ultrasound actually will transmit a temperature of about 60 to 65 degrees underneath to even up our sagginess. Will eventually heat up the connective tissue and the fibrous tissue of collagen to stimulate more collagen and eventually strengthen our skin. So with this thermal stimulation, it actually collagen stimulate in a month. So you can see your your skin will be tightened and lifted in a month. And usually this effect will best seen in 3 months, okay, and will last you for a year depending on what kind of skin, how saggy is your skin, okay. So you can see that HIFU, you can see that this area here, there's a bit of sagginess of the jaw. After HIFU treatment, it can actually straighten here a bit, okay. Now come to thread lift. Just now we mentioned to have skin tightened. One is by HIFU, no injection, and no surgical. For thread lift for face, it is we inserted a thread, put a little hole here to inject a thread to pull it out. Your skin that will have immediate facelift, but however, it needs time for collagen to stimulate, and slowly the skin will be tightened up. Okay, so for HIFU, the result we'll see in a month. For thread lift, the result we'll see in 1 month as well, because you need time, a minimum downtime like a week to recover. Okay, and it lasts you for 18 to 24 months. So for her, you can see that this is, we call it nasolabial fold, and you can see the face, the fat disposition droopy here. It's a bit droopy here. So after thread lift, you can see that line improved, and also this jawline is actually smoothened, not like here, a bit droopy. And this as well. After thread lift, you can see the improvement of the jawline actually lifted, and the face actually eventually become a bit smaller. The jaw area is a bit smaller. So the take-home message is science has studied the features of a youthful appearance, and we aim to maintain this natural look and age gracefully. So beautiful and attractive features can be enhanced using minimally invasive procedure with a very minimum downtime. Men and women are now getting these treatments. So it's actually a very common it's very common procedure to do nowadays. Okay, so when you look good, you'll feel good. So you can get some of the information from my blog to see whether what are the updates in aesthetic, and whether to put or not to put as in aesthetic, because there's always a choice whether to get injectable or non-injectable for your facial anti-aging treatments. So thank you.
Thank you, Dr. Alicia. you should stop share the slide.
Oh, stop share.
Yeah.
Where? Okay. Sorry.
And thanks to those that actually stay with us. Now we actually open to Q&A section. So if you have any questions, want to ask Dr. Alicia, do drop us in the comment box. Meanwhile, okay, let's do some interactive sessions. Probably what Dr. Alicia usually met is patients or not clients that actually show you a picture that, oh, I want to do this kind of nose, I want to do this kind of V-shaped lip. But how about for those people, okay, for example, like me, probably I feel that I'm not that perfect enough in terms of my looks. So if I come to you, how do you suggest actually what kind of aesthetic treatments actually I should proceed to make me look better?
But usually
Maybe you can do a live. We do a live consultation now.
Live consultation. Actually, what is your concern? Usually I'll ask, what is your concern?
What is my concern?
You look, I mean, they will tell me, like sometimes they will tell me you look tired and you want to enhance somewhere. Like, I mean, is there any specific things that you want to look into?
Yeah, look more energetic kind. I mean, give a good, very attractive impressions to people.
Oh, okay. Okay. So, well,
so I'm close enough for you to check on my face.
Yeah. Okay. No, if you say that you want to look more alert and less tired, probably you have to fix the under eye. So there's a loss of volume over your tear trough region and your mid face. So injection of the fillers to replenish the volume is actually improve your look on the tiredness. Okay. With injection of this also can actually lift it a bit of your this part here, your lower cheek area. You can lift it a bit because now the support here is less. So if injection of the replenish the volume over here can actually pull up your skin a bit. Your droopy here can actually improve. Yeah.
But from these two suggestions, actually I have a questions like, okay, because I have sinus, so usually people that actually with sinus, they will tend to have dark circles. So if I still persisting having sinus, so is the treatments will still help?
Of course, depending on what is the cause of your sinus first. Of course, you have to treat your sinus. It's the norm that sinus can actually cause the what is that called? Cause the dark circle. But of course, you have to treat you have to treat your sinus. But aesthetic treatment can actually treat your dark circle immediately. Yeah. Can treat your dark circle, you look less tired. But sinus also, you need to control what are the trigger factors that cause your sinus. Sometimes sinus can, let's say you're allergic to anything, can actually trigger and cause the sinus. Yeah.
So, I mean, my sinus is not solved. Actually, the dark circle will still persist, right?
Again,
but
sorry?
I have to, even though my sinus is not soft, right, my dark circle will still persist, and I need to keep on doing the filler, which actually will help me to reduce on that.
Yeah, the dark circle can help, yes.
Okay, then about because you say for fillers and check also will pull up my cheek here, but you can see, I know I have chubby face. Some people actually comments, actually I met some salons people actually. They comment that I need to, because of my shape of the bone is square. So the suggestions of them is I need to shape, I don't know what to call it in English.
Shaping the bone.
Yep. So is that necessary for me to do that, or actually I can just go ahead with your suggestions and do the filler injection?
Fillers adjust this part. If depending on whether your muscle is whether you have muscle here, I need to examine. So if let's say you have a big muscle over your jaw region, we can do an injection to relax the muscle, eventually it becomes slimmer. Okay, if that is the fat here, okay, we can after you do the fillers, sometimes your fat over here, we can do thread lift to actually reposition the fat back on top, then you disappear already. It's because sometimes we age, right? The fat disposition just let our supper will droop a bit. So with the thread, you can actually pull up, reposition. It doesn't, we don't burn your fat. We only reposition the fat so that you have the volume. Doesn't mean that you have a lot of fat over your face is not good. Sometimes less fat can make you look more haggard.
Understand. Okay, besides that, what else actually you can comment? I need to go
Can do double eyelid.
You sure I don't? But double eyelid is not enough.
Huh?
So it's not obvious, right? It's not obvious what you mean, is it?
No, double eyelid. You can do double eyelid to make your eyes, because your skin is covering a bit already. So you can do double eyelid to actually improve, to make your eyes look a bit bigger, and also can have more 3D.
Okay. Then how about my nose?
But your nose, I think, is okay compared to others. The nose still okay, I think. If you want, you can enhance. Of course, it can enhance a bit higher. But if you ask me which one to do first, probably you want to look more. You look more okay after the one treatment, which is the under eye
Go
and
away.
also the double eyelid. It will help.
Oh, okay.
Oh,
All
okay.
right.
The nose, I think, still can wait.
My nose is still perfect. I'm not perfect. My nose is still acceptable. Okay, now we have a questions from the live. Okay.
Okay.
Why there are people their facial expressions look unnatural after injecting the Botox?
Okay. So it actually nowadays the trend we go for natural look, right? So the dose is very important. We still do Botox injection, we still do this spot injection, but the correct dose is very important. Nowadays we use this toxin, right, to actually correct our facial expression. For example, our resting face, right? Let's say like that, like this. We can actually inject, make it smiley face, smiley lips, so that we don't even, we keep quiet, right? We are as if we are smiling, so like very friendly, you know. Yeah, and also sometimes the eyebrow, let's say the eyebrow is like very angry looking like this, so we can actually relax us a bit, then you look more harmony a bit. And some of them is very droopy, we can actually raise a bit with injection of Botox. Yeah, that can actually adjust the facial expression. And you are saying that not natural is because the placement probably not the correct, not so correct, and also the dose are not so correct. Yeah.
It's not because there's too frequent of doing Botox injections that make the unnatural facial expression, right?
Too frequent. I don't think so, because the effect will be like 5 to 6 months. Like if let's say you do for about 3 times, then you probably space it in a year, because you already become natural already. Yeah.
Oh, okay, understand. Okay, this next question. Hi, Sharifa. Who would benefit more from HIFU versus thread lift?
Okay. So those who doesn't, it depends, those that don't want injection and doesn't want anything, just want don't want injection, don't want any minimum invasive, they can go for HIFU. So HIFU for younger, basically HIFU is for younger skin. Okay. Younger skin, such as you can start doing in maybe 20s to 30s, you can start doing HIFU, no problem. Thread lift also you can start doing, but thread lift is a bit invasive, a little bit invasive. You need to put a little bit, open a little hole here and put the thread in and lift it up. And this thread lift actually have immediate, kind of like immediate result, because you can put a thread and put it out, you will have immediate results. HIFU also will have immediate, but not so much, because you can imagine one with the string, one without the string. Yeah. Did I answer the question? Like, I mean, the skin, HIFU is for younger skin, and if older skin, if you're worried about worry about injection and worry about this thread lift, you can do it, probably do it more frequent, like a year, maybe 3 times to 4 times, and for younger skin, maybe once in a year. Yeah, that's the things that you can choose to do. Yeah.
Okay, so okay, what actually I have a question that during your past sessions that someone actually asked, what is the advice procedures that actually can do to remove burn skin leftover scar on the face due to burnt. What actually what's the suggestions, treatments?
Okay, so the burn the burns from oil or from hot water, right? You are saying something like that, hot burn, right? It depends on how bad is the burn, is whether the full thickness burn or partial thickness burn. Means that how bad is the burn, what is the depth of the burn. Okay, so treatment will be ranging from like a scar removing ointment, either PRP, the ointment to apply topical, or PRP or skin boosters, and even minor surgery like scar revision. Therefore, need a proper assessment, then only we can see from there. So the ranging from topical until surgery, there is a range depending on how deep is the burn, how bad is the burn, the depth of the skin burn. Yeah.
Okay. So just now to talk about PRP treatments. So what is the difference between stem cell therapy? Because I heard that there's a stem cell therapy in the aesthetic line and also platelet-rich plasma injections. Actually, what's the difference? Both is actually taken from the client's blood, right?
No, actually, stem cells basically is a cells that can differentiate from to many different types of cells in the body. So some stem cell can be harvested from fats, our fat cells. Yeah, our own fats. We can take our own fat out, then we process, then we can get the stem cells. Okay. So or the stem cell from the bone or the bone marrow. After medication, after we take some medication, then we stimulate the stem cell from the bone marrow, and this one can get from so the stem cells can be from as I say, from the fat and from the bone marrow. For PRP, basically is from our own blood. So we extracting the cells from our body, our blood cells. There's stem cells, there's growth factors. So all these are anti-aging. There's some healing properties in our body. That's the difference between where the cells harvested from.
But in terms of the usage, because both is meant for new cell generations, so actually in what conditions we should use stem cell instead of PRP? Any reasons?
Well, but for PRP, actually both actually have healing properties, and it will heal the healing potential actually. For stem cells, it can help with general health, more function actually. For PRP, for healing certain parts of let's say we have a burn wound, we can do PRP. We also can do stem cells, but of course stem cells will be more, in price-wise, will be more expensive, and it's harder to get the stem cells actually. PRP, we get it from our body, our blood.
Our blood.
Yeah.
Okay, there's also questions. Is there any minimum age for aesthetic treatment? There will be maybe
above 18.
Above 18. Okay. There were people did their first treatment since teen, will that affect the growth of 14, 16 years old teen since they are still growing? I mean, her second question is that if like there's a teenagers that like 14, 16-year-olds, they start doing, I mean, they're going for aesthetic treatment. Will this affect, yeah, because that is the period where they in the
Depending
growing
on
process.
what aesthetic procedure they are talking about. If let's say their skin is like acne skin, their skin health treatment. So your aesthetic means the features or the skin problems, because a lot of teenagers actually come for skin health treatments for their acne problem and for their pore clots problems.
They didn't
Yeah.
specify.
So if aesthetic, the teens will come for aesthetic is the double eyelid usually. Yeah.
So when they grow, I mean, they
It
do the
won't.
double eyelid for it. It won't affect when gradually they grow. No. Okay.
No.
Next question from me is that heard that actually if you're doing something, I mean, get a nose job, actually it helps to stop snoring as well. So is it true? How does this actually work?
Okay. So if let's say okay, there are multiple multiple causes of snoring. The nose track that I mentioned earlier in my talk, right? It is deal with the outer surface of the nose realignment. Means that if there's a cause, it will improve. If let's say this tip, right, is actually covered like this, so it blocking this, right? So if the track can help me make it higher, so it actually
Lift that up.
improve with the snoring. If let's say the internal problem, let's say there's some septum deviation and there's some other problem internally or a growth inside at a gland that overgrow that cause snoring, of course it won't help with that cause snoring. You get what I mean? The structural outside
Yes.
can actually help with the snoring, but not inside. Yeah.
Okay, understand. Yeah.
Mm.
Okay, I do have friends actually questions that they have large porous skin, really large, like the surface of the moon. Very
Surface of
large,
the wound. Okay.
very large pores, and
There
I
acne
think
scars?
it's due to when youngs they like to squeeze the pimples and then hurt it, pinch the pimple and hurt it, and become very big pores and sort of like swollen sometimes. What treatments actually doctor will suggest them to do to fix this problem?
Of course, there are few options for this large porous skin. It can, but it actually, after listen to this, it can be an acne scars, it can be a large pores. Okay, with large pores, there's few options. Injection of botox also can help to shrink the pores. Laser therapy, or even the skin booster can actually help as well. With combination of all these can actually help with the large pores. And
It
also
would be.
sorry?
Will it be one time all for actually we need a few sections of the treatments?
Probably you need a few session. You need
Okay.
a few session, but injection of the botox can actually help one session in probably 5 months. The others probably monthly basis.
Due to the acne scar is the same suggestion as well, right?
If acne scar, I wouldn't inject this botox. Probably a combination therapy such as like skin booster or even PRP or even lasers combination can actually work on the acne scars. And sometimes very deep scar, we do subcision. What is subcision means that we remove the scar tissue underneath, so that it relaxes the scar from the deep layer, so that it won't pull the skin downwards. Very hard to imagine, right? Wait, let me draw. Wait, let me draw. Okay. Can you see?
very light or cannot see.
Wait, wait, okay, let me draw
Thicker a little bit the line.
Okay, can you see?
Yep. Okay.
So what happened is, let's say this is our outer skin, and this is the acne scars that is very deep. So usually what happened is when after the acne, there's acne, right? The healing process, there's a scar, they will form scar. So this scar, what happened is they pull the skin down. So we will do subcision to remove the scar so that the skin will slowly come up. Yeah.
Okay, I understand. Okay. Okay. I think another things that public will concern is that while they're doing the face aesthetic treatment, will them be knocked out? I mean, totally unconscious when you do the
Of
treatment.
course not. It's, as I say, all the mostly facial aesthetic procedure probably in 10 minutes or 30 minutes. That's all. And a lot of the procedure are lunchtime procedure. Yeah.
Oh, okay.
No
Okay.
knockout.
Then okay. Next, then we actually heard that vitamin C injection is actually restricted. Any reason on that?
Well, IV vitamin C, right, is being studied internationally, and its indication are expanding. Also, there are many people claiming that to give IV vitamin C is to improve well-being. So the quality of these products are not regulated yet. So all I can say is to get your treatment from a qualified doctors. Because now in Malaysia doesn't have a proper regulator whether the product are okay or not okay. Yeah. In other countries, some of them are just trying on vitamin C on like cancer patients. It actually improves. So depends on what is the indications. Yeah.
Okay. Okay, there's also, I think this will be the last question from the floor. What procedure do you use to give the smiley expression you mentioned earlier?
Smiley expression? There's
What
few depends
procedure?
what procedure. There's
I
talk about
remember
that I
lip,
got, yes.
lip accommodation, timber. You see, I got listen your talk.
Okay. No, the question is smiley expression, right?
Yes,
Okay.
smiley expressions.
So depending, first of all, have to see your lips. Depending on your angle of the mouth, whether first the volume enough or not, the volume of your lips. Okay. This angle of the mouth, whether it's downturn or higher up here. So there's few ways to do it. We usually reshape your lips, or sometimes the muscle too what is that called? Too tight, overactive muscle.
Tense.
Too tense, yeah. Too tense and pull your muscle like this. So we actually relaxes the muscle here so that your muscle will be more relaxed here, then you come in smiling. Yeah, so there's combination of treatments that depending on what lips you are, like what is your condition. Yeah, so the lips, the reshaping is actually the most common treatments compared to the tight muscle. So usually it's the shaping of your lips is important.
Okay.
Yeah.
Okay, how about the last, probably the summarize a little bit, not summarize, like the last advice actually for them, for public to know is that how long actually a facial aesthetic treatment takes for recovering, and what is the preparations, and also the preparations when they want to come for the treatments.
Okay, usually our procedure, right, is probably take okay, the procedure probably take 10 to 30 minutes. Okay, and what to prepare before you comes. So some of them they have functions to go. So usually we'll advise patient probably like 2 to 3 days before, like not like tomorrow you go for function, you come yesterday, like the day before. So we'll probably ask to come probably in a week so that you have time to have a time to buy, so that it can look better after in a week. Even though there's the procedure is a lunchtime procedure, but of course the small like injection of the bottles, you can just come. Sometimes they might have a bit of what is that called, probably the patient first time doing, they are not used to it, and they tends to be a bit nervous. So the time gap for preparation, as you mentioned, probably 2 to 3 days before like any function, if basically actually nothing to prepare.
You mean once I walk in to do consulting, straight away actually?
Yeah, you can do immediately. There's no preparation.
Okay. The recovery time is also not much to each. It's not like I will have redness, then I need few days to recover them.
You will have redness, but it won't last you until 2 to 3 days, probably on the day itself, and eventually disappear by end of the day. Yeah.
Okay, great. Before we end, you have any advice to our public?
Advice.
Yeah.
Oh.
Yeah, any advice regarding
advice to have a encourage to have a healthy lifestyle. Hydrate yourself more. Take food wise, probably less fried food, of course, less sugary food, and be happy.
Happy.
Be
Okay.
happy. Yeah.
Thank you, Dr. Alicia, for tonight sharing, and thanks for the friends that is still with us. And do help us to share out today's Dr. Alicia sharing, so that more people actually understand aesthetic treatment is actually not scary. It's actually quite common now.
Not at all.
Okay, to build your own confidence, especially. Okay, never forget that do like our page, okay, and share out. Before and then, I would like to inform that this coming Wednesday, we are going to have a topic by a psychiatrist, Dr. Sid, to talk about mental health for COVID-19.
Oh.
So for information, please check out our announcement post. And the right clinics, the right doctor, the right care, the right information, the right knowledge, no panic, stay at home. Good night, everyone. Good night, Dr. Alicia.
Good night.
Bye-bye.
See y'all. Bye.